everyone. I'm Erin, and I, along with my co-interviewer Aman, will be conducting today's interview with Dr. Bilyeu, who's an OBGYN. And just to start off, Dr. Bilyeu, can you just explain a little bit about yourself and what led you to this path?
Sure. I'm Amy Bilyeu. I'm a general OBGYN here at SLU. I am originally from Springfield, Illinois, so not far from here. And then I did my undergrad here at SLU and actually medical school here at SLU as well. I then went to Washington Hospital Center, Georgetown for residency in DC. And that's a 4-year residency that after I graduated, I actually came back here and worked for SLU. So I've been here since graduating in 2015. And like I said, I'm a general OBGYN, so part of general practice where I do obstetric and gynecologic care. So I do kind of the whole gamut.
Awesome. And then to start us off, can you explain a little bit about what you do in a day and really what med students should know about your specialty?
Yeah, so OBGYN is maybe a little biased, but a very diverse and cool specialty because we get to do lots of different things. So my week, every day there's something different. So I do, like for my week, for instance, on Mondays, I see patients in my private office. So I see like well woman exams, problem visits, anywhere from like abnormal bleeding or vaginal discharge. I see OB patients, so obstetric visits, and do procedures in the office. So placing IUDs or doing biopsies. And then on Tuesday, I have OR time in the morning. So I operate, and those are anything ranging from procedures on the cervix to taking out ovarian cysts to doing hysterectomies or removing the uterus. Tuesday afternoon, I cover a resident clinic because I'm an academic. So I do work with learners. And so there's a resident run clinic that I oversee on Tuesday afternoons. Wednesday, I go out to the county clinic. So I work at a clinic who serves underserved, uninsured, or limited insurance patients. Thursday, I have OR time again. So in the morning, I operate. And then Thursday afternoon, I do things at the medical school. So do small group sessions and things like that. And then Friday, I cover labor and delivery. So it's kind of every day is a little bit different, which is really nice. I think I realized pretty late in my career, but luckily I chose the right path, that I probably have a little bit of adult ADD, and I like that I have a variety in my practice. There's some specialties that it's just outpatient or just inpatient, and you kind of do the same thing every single day. And so I like that there's variety within my week. It keeps me on my toes, makes me kind of not get so bored. So that's really nice. But I also am academics, obviously, and I really like teaching. So that's a big part of what I do as well. So there's lots of teaching on the wards and in the office, and formal teaching where I, do lectures and things like that. I also take call. So OBGYNs definitely take call. There's a lot of specialties that do, but I would say OBGYN tend to have pretty rough call schedules sometimes because babies are born at all hours of the day. So I personally take 2 calls a month, which actually is really, really light for most OBGYNs. Sometimes you could take call, a week at a time, or every other day, or every third day, or maybe once a week, and then cover a weekend every 8 weekends. So the call schedule can vary depending on your group and how many partners you have, and kind of what your coverage is. But in academics, we tend to have a better call schedule because our group is so big. So I only have to take 2 calls a month, which is nice. But those are in-house calls. So I'm in-house overnight, covering all the labor and delivery patients, anybody on the floor that's having issues in the ER. A lot of specialties will take home call, but some OBGYNs can take home call, but they go in because you have to be there for deliveries. So there's not, there's opportunity to stay at home and do home call, but often it's not always the case for OBGYN. What else? Yeah, any other
One
questions about
follow-up
OB?
question I had
Yeah.
was just like, can you describe some of the patient population that you see normally?
Yeah, so because I work here inner city in St. Louis, I'm working at St. Mary's and the county clinic. The patient population I see is mostly African American. I do have probably 60% like Medicaid or underinsured, 40% private insurance. So it's kind of it's a wide variety, which is nice. But yeah, it's the typical kind of city patient population.
And then additionally, like I know you touched on this, but how did you like know that this specialty was right for you? Did you have like an aha moment or it happened
Yeah,
more gradually?
I totally had an aha moment. I think that OBGYN is one of those specialties that you don't get a lot of exposure in medical school until third year. You get a little bit when you do like reproductive and endocrinology, but it was never on my radar as a medical student until I got to third year. I knew I wanted to do something surgical. So I knew that I liked procedures, and I always was the first one to sign up for the, suture lab and anything that I could use my hands. And so I was originally thinking general surgery because that's kind of what you think of when you think you want to do something in the OR. And so I set up my third year with the thought that I was going to do general surgery. And so OB was actually my second rotation. I wanted to do that before general surgery. So I knew my way around the OR because I knew you also got to do the OR and OB. And it was almost immediate. As soon as I got on the rotation, I was like, oh no, like this actually might be what I want to do. And I just had no idea. It was the one rotation that I didn't want to leave. You do rotations for whatever 6 to 8 weeks, and at the end of every single one I was like, okay, I'm ready for the next thing. But OB, I didn't want to get off the rotation. I enjoyed all the different parts. I liked the continuity of care that you get. You take care of someone through their reproductive life, where they're having babies, into menopause, or giving them their hysterectomy. There's just so much care that you provide throughout a lifetime. You have patients that follow you for years, and you really get to know them, and then they send their daughter to you. And I just really liked that. I really liked that there is OR time too. So not only do I get continuity of care, but I also get to do procedures, which a lot of surgical subspecialties, you don't get the continuity of care. And then a lot of the specialties that you get the continuity of care, you don't get enough procedures. And so it was a very good blend of the two. And I really like taking care of women. I find it really empowering to take care of women and educate women on their bodies and their menstrual cycles, and how to protect themselves from infections, and then walk them through their first pregnancy and delivery. And so it was really empowering for me to feel like I was making a difference in a group of people that sometimes don't get that opportunity to learn and be empowered. So yeah. And then from that point forward, I thought I still may do general surgery. And then I just, for the rest of the year, did not love anything as much as I loved being on OBGYN. So it was a third year kind of decision for me.
And then looking back, is there anything you wish you would have known or done differently as a medical student?
Um, I have to say that I would hate to admit this because I'm going to show my age, but I went to medical school in a little different kind of era than you guys. Like, I still had like the step one score, and things weren't as competitive. I always look back and I'm like, if I was applying to medical school now, I don't think I'd get in. It was just, you guys do so much to get into medical school. And so I think it's just a different environment now. An OBGYN is getting a lot more competitive now than it was when I was applying to OB. So, I'm not sure I have anything remarkable to say that I would do differently, because I think you guys are already doing so much more than I did. But what I would say is, and this is true for all specialties at this point, with, your step one being pass fail now. I think any specialty that you choose, they're going to look at your extracurriculars now, like the stress may be off step one, but it's not gone, right? It was just kind of shuffled to something else. And so now it's being shuffled to your research and your extracurriculars. And there still has to be something that kind of makes you stand apart from other applicants. And so I think actually that is a good thing, because I think you should be spending more time giving back to your community and getting involved with your community and service work, because that is going to make you not only a better physician, but a better person. And so at this point, I recommend for you guys to just get back involved in the community, find something that you're passionate about and have a long-term commitment. And that looks really good on your CV, and that will kind of stand out. As far as like education wise, like I just, I think I do wish, this has nothing to do with me being an OBGYN, but I do wish that I would have done more other rotations outside of OB before I left med school. Because you will never see that stuff again. Like I do OBGYN for the rest of my life. So like to be able to like do like, I don't know, a neurosurgery rotation where I got to do brain surgery for a couple weeks, or like, just to like kind of get a variety of experience before I dived into the thing that I'm going to do for the rest of my life. I probably would have like kind of, increased the variety of my rotations in med school to be something not OBGYN related, actually.
That's a good point. I hadn't really thought about that, because especially once you're interested in something, it seems like, well, of course you're going to do rotations in that, but I like your point there.
Yeah.
And
you
then
have to do some rotations in there, right? You got to get your letters or whatever, but like do the bare minimum. Like you really don't need to like fill your schedule with whatever specialty you're going to do, because that's what you'll do forever.
Right. And then since you are in academic medicine, are there any specific resources that you would recommend med students use now? I know with like step one being pass fail, that's a little bit different, but any resources or other tips that you would use, maybe even just for studying in general and not necessarily like specific to OBGYN?
You guys are way smarter than I am at all of these resources. We never had all of these third-party resources that you guys have. I think it's fantastic that along the way, medical students or residents have put together things for you guys to like study on. There's nothing like specific, I think the old answer was always these like textbooks, right? There's like these big textbooks with these big names of, of all of these like famous physicians. And they're like, oh, like Williams obstetrics and Talen's GYN and all of these things. Like, I think those are great. But those are kind of gone by the wayside. So, I mean, at this point, I think there's just so much technology and different third-party resources that you guys use that seem to get you guys to like learn what you need to know so much better than just reading a textbook that gets outdated by the time it's published. And so I don't think I have a good answer. I think if you asked all the other people in this room, their answers would be better than mine.
Switching topics a little bit, I was curious to hear about like if you like what you would I guess like see or qualities of like a good OBGYN resident, like people interested in OBGYN, what are the qualities they should have?
Yeah. So I think what makes a good OBGYN resident is someone who is hardworking and a team player. All specialties have teams, but I think especially OBGYN, even when you're out in practice, everything you do is team related. Your OR team, your labor and delivery team, with the labor nurses and the charge nurse and your scrub techs and anesthesia, we just are constantly working in teams. And so I think the ability to be able to work well with other people, and OBGYN residency is really hard. It's one of the hardest residencies I think there is. There's just all this, surgical subspecialty residencies are just hard. They work long hours. And so being a team player and realizing that, like, picking up work and slack when your fellow residents need the help will just pay you back when you need the help. And so I think that's a really huge quality. And then just to be humble and the ability to ask for help and not get too in your head about trying to be the best of the best. When you're a surgeon, you have to know where your threshold is and to be able to, you know, push yourself and push the boundaries, but all with the patient safety in mind. I think it's really important for us to be humble and not get too, too proud to ask for help. But yeah, those are probably the biggest, hard worker, team player, and someone who just wants to learn and is willing to do the work.
I was also curious if you could speak about like the future of OBGYN. Where do you see the specialty heading in the next like 5, 10 years?
Yeah, I think that OBGYN is such a big specialty. It encompasses so much. There's general OBGYN, but we have a lot of subspecialties within OBGYN, which I can touch on in a second if you want. But I think the variety of the care that we do is so vast. And like the thing that keeps us all kind of together is that we take care of women. I do think that at some point things might start kind of branching off a little bit more. Instead of all being under kind of this OBGYN umbrella, they might start separating like obstetrics and gynecology or things like that, which they've already started doing in some places in the country, mostly on like the West and East Coast. I think that might be something that is more prevalent in the big cities. Rural medicine is a little bit different because I think you kind of take care of a lot of different things in rural medicine. But I do think that there's probably going to be some branching off of specialties or separating OB from GYN down the road. I don't know when that will be. It may be far off, or it may just only be seen in the big cities. But there's kind of a big difference between those two, and we combine them because it's both women's care, and it sort of makes sense and it overlaps, but it's very different skill sets. So
That was like the first time I've heard about that. So do you have like an opinion on whether those should be two separate things or together? I found that really interesting.
yeah, I personally like the variety. So if you make me choose one or the other, like I think that is why there are lots of people who go into OB. I think there's a lot of people that if they choose to separate the two, there might be a lot more people who specialize, because I think a lot of people stay a general OBGYN because they like the variety. They don't want to give up one or the other. Because if you do a subspecialty, you tend to give up one or the other. And so I do think that it would probably, it may decrease some people who go into OBGYN, but you might find more like people who may now do kind of family medicine with an OB, like kind of specialty, would do obstetrics maybe, but they didn't like the surgery part because they didn't like being in the OR. So I don't know, it may just kind of attract different people if they do that. I personally would not like it because I like the variety.
And do you mind touching on those subspecialties that you
Yeah.
were talking about a little while ago?
So there are board certified subspecialties. So they're actually like recognized by our board, like the American Board of Obstetrics and Gynecology is as board certified. And then there's other subspecialties that you can kind of get further training in, but they aren't necessarily board certified, which means that you take a test and prove that you can meet the standard of care in that subspecialty. But the ones that are board certified are gynecology, oncology, so GYN cancer, urogynecology, and those providers do vaginal surgery and kind of work with a lot of like prolapse and menopausal patients who have urinary incontinence or things like that. Reproductive endocrinology and infertility, and that subspecialty works with mostly mostly do infertility stuff, but a little bit of endocrine. Pediatric adolescent, so the specialty that kind of works with the peds adolescent population. What else? Minimally invasive GYN surgery. So they kind of do a little bit more training in the OR and with minimally invasive surgery. What else am I missing? There's some other kind of smaller ones like infectious disease, critical care, maternal fetal medicine, of course, MFM, so high risk pregnancies is a board certified one. So there's smaller ones like infectious disease, critical care, family planning, that kind of focuses on, reproductive care, contraception, terminations. I'm sure there are others that I'm not thinking of, but those are the main ones.
And then can you touch a little bit about what your favorite part of your job is and what might be your least favorite part?
Yeah. My favorite part, hands down, is teaching. I do love my job. I love the clinical aspect of my job, but what keeps me going is teaching and being around learners and teaching the next generation of physicians to be better than my generation of physicians. I just think that is really cool and a very unique and special position that I'm in, that I get to do that. And so that is hands down my favorite part. I like mentoring, trying to make the road easier for you guys and for other people that come behind me. I just think that it's really fulfilling. My least favorite part is probably, and this is sort of a cop out, but is all of the like charting and paperwork. I know that's like not really that good of an answer, but I think I spend way too much time in front of a screen and doing clicking and boxes and I get why I have to do it, but sometimes that's frustrating. I do think we work pretty hard as OBGYNs. Most of my weeks, probably on average, I'm working 50 hours a week. So it's a little bit more than some of the subspecialties or specialties in medicine. And I do try to come in for a lot of my patients' deliveries. And so that can be kind of tiring if I'm coming in, in the middle of the night. And I think my family would probably say that it feels like I work a little bit more than that, but I do have a good, work-life balance. I know that's really important to you guys, and it should be, and it's becoming more of a importance in a lot of people's lives, and having that happy work-life balance. So I do think it's getting better, and I don't have to come in if I don't want to, or if I can't. So that is nice. But we OBGYNs tend to work pretty hard.
And then do you have any last pieces of advice to medical students, whether they're interested in OBGYN or not?
Yeah, I would say, this is what I say to all of my mentees who I mentor in med school. I think medical school is just like anything else. The more you put into it, the more you're going to get out. And sometimes there are some days that's really hard to do, and you're just counting down the hours and you want to go home early or whatever. And this includes all aspects of medical school: social, academic. During your third year, the more that you put in and the more that you are willing to kind of feel uncomfortable and do things that maybe you don't know what you're doing, and you're feeling like you don't want to look like you don't know what you're doing, but kind of just jump in head first, you're going to get way more out of med school and your career and life in general doing that. And we have our good days and bad days. Some days, you know what, don't put more in, like you might need to take a break. But in general, I think the more that you see, the more that you do, the more that you get involved in anything, the more you're going to get out of it.
Thank you so much. If you have any questions, people in the chat, you could put it in the chat box or just ask out loud, and then we'll wrap up.
Hi, Dr. Bilyeu. Thank you again for doing this for us. I did have a question. You mentioned that there's a big difference between rural medicine and what you do in the city, and I know you mentioned that you do both. Can you talk about a little bit about the difference between those and some discrepancies that you may see?
Yeah, so I think the kind of the benefit of working in an urban environment or a big city is that you have a lot of subspecialties around. So there's just a lot more resources as far as, specialty physicians to kind of look to or be able to refer to. Rural medicine, often you may be the only OBGYN in a very large radius. And so you do a lot more of kind of the subspecialty stuff that if you were in the city, you may send to a urogynecologist or a maternal fetal medicine doctor that you may have to do just because of location. So rural medicine, I think, tends to sometimes get a little bit more creative and be able with like their resources and who they have around for support. And then the big city tends to get a little bit more, complicated patients, right? Because the big city are referral centers. So when things kind of get too complicated for people who are in more rural environments, they would then send them, to a referral center. So sometimes you get a little bit more difficult pathology or advanced cases of things being in working in an inner city. That's probably the big difference. And sometimes if you're the only OBGYN, that means you are on call 24 hours a day, 7 days a week. And that can be a little rough, but it's just your patients. So at least you're only covering the amount of patients that you can physically have and see. So it tends to be not as busy, but.
Thank you.
You're welcome.
All right, do we have any other questions before we end here? All right, well, thank you again so much, Dr. Bilyeu, for joining us. This was very informative. I know I learned a lot, and I'm sure everyone else did too. So yeah, thanks for joining us.
Perfect. Thank you for having me. You guys have a good night.
You too.